hear your thoughts and, given your different areas of expertise, how social prescribing fits within your context.
Well, thank you for inviting me today, and excellent keynote to hear about the importance of social prescribing for emotional and physical health and well-being. So my work, I don't really do social prescribing per se, but the work that I've done really highlights the importance of it. So the work that I've done is mostly around examining issues around social isolation in people with physical disabilities or older adults or other underserved communities. And if anyone, as going through the pandemic, we know how impactful being isolated or lonely can be. And there's evidence showing that it's worse than smoking 15 cigarettes a day, worse than physical inactivity. So I'm glad to hear someone in the audience does sports, worse than air pollution. And there's a number of studies showing that if you're isolated, it can lead to premature death. So all of these things have a social, an impact on our physical and mental health, and leads to hospitalization, leads to earlier rates of dementia, all sorts of negative things. And so really having those social connections are really important for, as a preventative measure, so that people can actually stay well and out of the hospital, and maybe when they go to the doctors, that it's not because they're lonely, but because they actually have medical issues, because we are suffering overcrowding in our EDs and other things like that. And having those connections are really the pathways to better physical health. I tell the story, and again, just to dispel the myth of big brains, I tell this story because many years ago, I suddenly got a rash on my neck. And I thought, it's just a heat rash, it's not a big deal. And my wife said to me, you should go to the doctor. I said, I'm not going to go to the doctor. And all of us with partners or spouses know that look. So I wound up going to a walking clinic, and I had shingles. And because my wife had said, go to the walking clinic, I got the antivirals within that 48 hours and prevented all the neuropathic pain. So having that social connection was really vital to maintain my health. So it's really, we sometimes take these things for granted, but having people around us, having places to go can really promote our health and well-being. I'll turn it over.
Yeah, and I think, Natasha, I'm a fangirl of social prescribing, so I have to tone myself down. One thing that resonates is the things that keep us healthy is not healthcare, right? It's our life. It's the people, relationships, and money, right? You need to earn a living, and a connection to community. And we live in big cities now, modern society, in uncertain times. And so that value of connection and belonging, I think, resonates. One thing that I really think is the next spot that we need to move forward is examining those very important structural drivers. Leisure is a privilege, honestly. I'm a child of immigrants. My father drove a taxi for 16 hours a day. He did not have time to go to play sports and whatnot. So when you have something like social prescribing that really at the individual level prescribes you some leisure, some ability to afford to go to a museum, that is powerful. But I think we need to propel forward and look at the very things your report outlined. The things that enabled that was that free pass, was the kitchen, and food insecurity. I was blown away. At 83% of people said they are worried about food. So when you are worried about food for your kids, then you are worried for rent. The last thing we're worried about is going to a baseball game or even going to a doctor. And so I think from a health services researcher point, I'm very excited to partner and collaborate, and because the nugget I see is what are the economic, social, policy drivers upstream that reinforce what we're seeing at downstream. And when we talk about equity is, I live a middle class life that my father never did. And I realize what privilege it is to have paid vacation, to have health insurance, to have an employer who understands all of those needs. versus somebody working a factory job and very worried about losing that job. So as you can see, social prescribing is, I think, releasing the tip of the iceberg of where we need to unpack the bottom. And we've got brilliant people here. Like, this is amazing. And I look forward to the afternoon. But Natasha, like, the work that the Alliance has done is amazing. I think it's really cracked open the dialogue.
Good morning, everyone. I am a work and health researcher, so I focus on the workplace, and my main area of research is safe work integration of immigrants and refugees to Canada. So I study the conditions in the labor market and their first jobs, and also looking at how system partners, such as employers, policymakers, settlement services, health and safety prevention system, could create conditions for making work safer for immigrants. And as Natasha in her presentation mentioned, the social determinants of health. So the workplace and employment and working conditions are a huge, big, factor in terms of the social determinants of health. And you just mentioned. So because we know that immigrants and refugees have a higher risk of illness and injuries in the workplace. So just like thinking about a little bit like the health component and safety component. And one of the reasons for that is because they tend to work in more hazardous jobs, manual labor, longer shifts, and like protections. So I kind of thought that coming here today, thinking about the social prescribing, I'm not a social prescribing researcher, but I thought that this is the kind of angle that I can bring in terms of like some thoughts around considerations on how work is an important social determinant of health and how we can improve the workplace. So maybe a few thoughts in terms of thinking about social prescribing more from the perspective of the workplace and immigration and labor market integration. So one of the things that we know, if a worker worries about going to work and feels like they're going to feel unsafe or they are going to get injured, that is a very serious problem, and that is actually experience of a lot of immigrants or refugees that we speak to in our research. So the other piece that I thought about maybe bringing in from my research in terms of thinking about some of the social structures, social supports, and also system level supports. Currently I do research in the area of linguistic diversity and language proficiency in workplaces. And one of the things that we know is employers can provide supports in terms of creating I look at it from more of the perspective of equity and linguistic justice and how important it is for immigrants or refugees who may not have the proficiency in language to be able to access supports, workplace supports, workplace health and safety information in their own languages, and also providing those kind of supports. But not only that, because we talk to immigrants who may be injured in their job or who may need legal assistance or healthcare assistance to have access to multilinguistic or language resources in that. So I can talk a little bit more, but I'm going to stop there in terms of that's how I orient myself in this context perhaps. But I'll just go ahead, please.
I don't really remember what the question was, but one thought that was a little bit triggered by what you were talking about loneliness was a challenge that we experienced at my health center was our funder requires that we see a number of new patients every month. And so we were running like a seniors tea, and it was like 75 older adults who came, and we were like, it's always the same older adults, and they're so demanding, and I have to get them cake, and so we were like, well, this doesn't make sense. We have the same group so we're going to cancel this seniors tea program. But then when we changed the lens and we looked at loneliness as a determinant of health, it was like, wait a minute, we want the same group of people coming so they can get to know each other and they can build some of those social connections. So then we started a coffee drop-in as a way of helping people, and this was a referral. We didn't promote it this way, but it was a referral only, and the folks in our clinician colleagues in primary care would refer people who they could identify as being lonely to our to our coffee group, and it became almost like exposure therapy for people who were quite isolated in their apartments to be able to come out and join a group, and then like they could slowly, maybe 6 months later, think about doing another kind of group, like an exercise group or a more health-focused group. But the coffee drop-in was like the gateway to get people out of to break the isolation of their homes.
Thank you so much for all sharing. I think a lot of your comments and responses, we know the benefit of social prescribing and engaging folks in social places and spaces. And, I think to my nonna, my grandmother, who's an immigrant to Canada, and if I told her, go to the social prescribing class, she'd look at me and say, what are you talking about? I'm not going to that. I don't know these people. Why do you want me to go do this? So how do we encourage buy-in and inform folks of the benefits of social prescribing and engaging in social contexts?
Sure, I can. Just a very quick, maybe a few words. In my research, we speak to employers who hire immigrants and refugees in very diverse workplaces, and one of the things that we talk to them about is, and they are very attuned to, the challenges, especially when we think about employment, we think about like settlement and employment. It is very much integrated. Settlement challenges create what kind of jobs immigrants can get and all of that. So one of the things that we hear from employers, for example, they're very aware of some of the settlement challenges that the workers that they hire in terms of settlement supports, language needs, childcare, and also they talk about the importance of mental health, but they do not know how to access these resources. So I guess one issue is to be able to understand as a system how to integrate these supports better, and also maybe, for example, increase awareness of the employers through local immigration partnerships or local supports in terms of maybe workplace could be a place where employers can direct their workers, or they connect with social support services. So I just thought that maybe it is more around collaboration within the system that could create opportunities for for social prescribing.
Yeah, just to bounce off that awareness piece is so critical. So I'm at St. John's Rehab, which is up north. It's a rehab center, but we're part of the larger Sunnybrook Health Sciences system. And the biggest issue is we have a high volume of seniors or older adults coming through our hospital, and they can't be discharged home because they don't have anyone there to help them, navigate their homes with transportation of getting out of the hospital. They're completely socially isolated, and they're unfortunately sometimes stuck in the hospital unnecessarily because the hospital can't discharge them in good faith. But there's all these programs and community agencies that are available that can connect older adults to personal support workers and other home supports and activities, so that they can be independent at home and maintain their health and well-being. But working in a busy emergency department or in the hospital, providers aren't always aware of what's out there. So having opportunities to share that information, promote it is really critical. And Sunnybrook, Sprint Senior Care, which is one of the agencies that we work with, works side by side in the emergency department with our acute care health team and raise awareness. We have a Meals on Wheels program, which is in the basement, that you can easily refer. We have recreational therapists that if you're really worried about someone being all alone and they need an activity, this might be a good way. So it's also, so it's the awareness and the packaging. And I love the example that you gave Natasha, where it's at a mall, and it's not as scary and it's more inclusive because it's not just a one-to-one interaction, or it's like you're meeting with a doctor and they're telling you what to do. It's more about a soft introduction. So I think the examples that you gave are excellent, but the awareness piece needs to be there, and to promote great work, including the Access Alliance, because without knowing your existence, people can't access those resources.
And then, quite briefly for your Nana, I think big brains, we like to create words that regular people don't understand. So social prescribing is irony, right? Prescription is for medicine. But you're not prescribing medicine, are you? You're prescribing what matters to you. And what matters to your Nona knows. And people are wise. And the problem with big brains and health systems is we like to create our own solutions. But the patient, the people, we know what the solution is. Your Nona knows. And all we need to do in the background, like a stage crew in a Broadway production, is to connect with each other so that your Nona gets to do what matters to her without lifting a finger, which means she can walk where she wants to walk, the transit is good, she has groceries in the fridge, she has friends, and whatever else she wants to do. And we should work in the background to make that happen.
It doesn't have to be complicated either. Like a physician colleague of mine was meeting with a client, and she said, I'm getting ready to retire, and I'm worried about this transition because I've been very career oriented. And the physician talked to her and said, like, what did you used to like to do? Oh, we used to go to church. Like a place of worship can be a place for social connection. So she started going back to church, this client, and then she joined the choir and was singing in the choir, but still kind of felt like something was missing, and she met with the doctor again, and she said, when I was growing up we had dogs, and so the client got a dog, and then she was walking her dog and she met all the people at the dog park and the other dog walkers. So then unfortunately something very catastrophic happened to this individual, but the people from the choir were like, you've missed 2 choir practices, we're dropping in to check on you. The people from the dog park were like, we haven't seen you, we're checking in. Okay, we're going to walk your dog, we're going to bring you food. So being able to kind of have that like that village, and I don't know, maybe your Nona had a village, and we didn't really, we don't know, but many of us, have lost our village, so it's kind of like rebuilding that social connection that can support us.
I'm sorry, Cliff.
No, it's okay. I just want to bring us back to Sandra's rash for a second. Not to talk about the rash, but the fact that Sandra had somebody who cared about him to be able to say, you need to go to a walk-in clinic. So having, social prescribing to me is about having those people who care about you and that you have that relationship with, who can help you, can support you, can point out things to you when we don't necessarily want to do them. And Rosie, that comment about leisure and how and that leisure is a privilege that not everybody gets to partake in. Not everybody gets to have fun with those friends, those families, the networks that we have, and how important it is that we are able to share leisure with people so that they can build those friendships and those networks, and that in the workplace it is an environment where we have to be purposeful in creating those opportunities for the people who are in that workplace to be able to connect to each other and to see and do more than just the work that is at hand. Those are all really important messages that I think I've heard this morning in terms of what you presented, Natasha, and the responses that are being given. That social prescribing, it is one of those words that really is, that it's really about what should be happening in the background, in the back room. That's not the right word, but like here. But what people really want and what people really need is to be able to just have those connections to each other. And Natasha, it's so interesting that when we think about those 75 people who continuously come to the group, if we only see the group as that T group, really, nobody wants to come to the lonely social person's club. So, no, we don't advertise it that way, but we have to be really conscious of that the purpose of many of the programs that we do, many of the services that we offer, really are about bringing people together because people are lonely, they are disconnected. It is a plague in North America. In many of our home countries, those connections exist. When you come to North America, there's a coldness in the North American culture that we have to be very, very conscious of and build those connections. Anyway, blah, 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 blah. That's my 2 cents.
Great. Well, thank you all very much for your insightful comments.